Hi there, are you somebody who suffers from lower back pain? Well, if so, I've got something I want to share with you today. Hi there, my name is Morgan Risden, and I'm the creator of Center Studio, where I teach people, just like you, my friend, skills to feel more comfortable more often. And if you are new to my channel, friend, welcome. I'm really glad to have you here. I hope if you enjoy today's content, you'll be sure and hit the subscribe button. Also, the notification bell that lets you know anytime I make a video like this, and you'll be sure to know about it. Now, when people talk to me about lower back pain, oftentimes I'm asking them, well, how do you find yourself sitting? And this is a common question because so many of us spend a lot of our day in a seated position, be it at work or at home, eating, etc. And so I often want to ask people to start assessing whether or not they're bearing a lot of weight in their lower back when they're in this position. Now, people tend to fall into one of the following two camps. They either are sitting a little bit further behind onto their tailbone, and that's going to be at the expense of their lower back, or they tend to be trying for good posture and they kind of bring up their chest towards the sky, but then of course again they're overarching in a different direction, and again it's at the expense of the spine. So I often ask students to first figure out, are you actually sitting on your sit bones? Now, as a reminder, I've done previous videos about this, but the sit bones are incredibly important and they're a bone. So you're supposed to have weight falling into them when you're seated. And if you take your hand and place them underneath your rear end, right, you'll kind of feel for those two bones, and they're a little bit closer than one would imagine. Now, you can also take your hands and place them at your hip joints in the center and kind of feel simultaneously where your hips are in relationship to your sit bones. I find that the sit bone tends to be a little bit further out and a little bit behind the hip joint. It can be a helpful sort of reference when you're searching for that, especially if you're somebody who has more muscle or fat tissue, etc., if you can't find it. If you're on the slimmer side, like myself, they can tend to get a little tender when you're seated on a harder surface, be it like a wooden bench or a stool that doesn't have a cushion. They can tend to get tender if you're not used to sitting on them because they are just bones, right? But once you've found them, you can place your hands underneath and play with where do you tend to be on top of them. So you can kind of go from the front position where you're sort of overarching and pushing that sternum up towards the sky, and then you can reverse sitting more onto the tailbone to see where am I usually placed on those sit bones. And you'll feel them really move, right? Because depending on where you are, they adjust. So while you may be sort of sitting on them, you might be slightly behind or in front of them, depending on what your habit tends to be. Now, of course, ideally, we would be sitting straight on top of them so that the weight goes all the way down, the weight being from your head down to your torso, all the way down into your sit bones. Otherwise, friend, when you're overarching, trying to have good posture, it's again at the expense of that lower back. So letting that release, allowing your sit bones to adjust so that the weight just falls straight through into your seat. And then same thing if you find that you're further behind, making sure, okay, wait, I'm not falling behind, I'm gonna sit straight on top. Now, for some people, especially those who are used to kind of pulling themselves up in this fashion, it can feel very slumpy because you're going in an opposite direction from this. It kind of goes this way, which feels a little bit like that. So if this is your experience, you feel like it's slumping, just hold off before you make any drastic decisions about abandoning this, and instead just place your hand around your body, sort of body map. This is what we call body mapping, touching yourself to figure out, where am I in space? Does my back feel straight, or does it feel arched? Does it feel slumped? You'll know if it's slumped because you'll feel more of those spinal bones coming out in the back, versus when you're here, you might feel less of that. You might feel more like a straight, sort of a straight back, so to speak. There's a small curvature in the back of the spine for most people. And of course, if you're somebody who has scoliosis, or you've got fusion of the spine, or any of the number of conditions that one might have, you might have slightly different situation. But generally speaking, most of us are going to have sort of this smooth, flat back with a slight curvature. But it's, again, you're not going to feel any sort of pressure in your muscles of your lower back because all of that weight is going straight down into your sit bones. The other thing I wanted to show you was a skeleton to show you exactly where the bones are in relationship to your lower back so that you have a better, clearer sense of that as well. As you'll see, this part of your lower back has all of these wonderful vertebrae, and then you have this tailbone, which is the largest bone of your entire spine, and then you also have these two sit bones. Now, they're very close together, and so it makes sense that a lot of people would tend to round down onto their tailbone, and or if they were trying to have good posture, sort of hoist up and sit a little bit in front of their sit bones. I want you to think about sitting directly on top of the sit bones to prevent any sort of excess pressure on the lower back, and just think about sending the weight all the way down to the bottom of your tailbone. So it's almost as though when you're seated upright, friend, no weight has to be bared at your lower back. It all goes straight down through the spine, through your tailbone, and then all the way into your sit bones. So that it's almost as though your center of gravity sort of skips the lower back and goes all the way down into whatever it is that's making contact, that you're making contact with. So if it's a chair, if it's a stool, if it's a bench, you're just letting the weight of your entire torso come down into those sit bones. Now, I hope you enjoyed today's video, friend. And of course, if you did, it would mean a lot to me if you'd hit the like button. Also, be sure to subscribe, and you can share this video with friends. All right, until next time, take care. Ciao.